Hi everyone, it's Marie Fell from the Pilates Physio. This little video is just to recap on the blog post that I wrote this month about what is prolapse and why are the pelvic floor exercises so important. I started going around some playgroups today with my pelvis and talking to ladies in the playgroup about pelvic floor, and I spoke to ladies who just had children and grandparents of people looking after their grandchildren, and it's really interesting to see what we've been told following birth of children or being pregnant in different generations. Quite an eye-opener. But I think it's really important that we talk about prolapse. It's not a nice subject to discuss, and it's certainly not something that we open up to over the dinner table with our friends. But from a professional point of view, we have pretty much seen and heard it all before, so to us it doesn't really shock us. If you've got anything that you think is horrendous, please do seek help and support if you need to. So I think the funny thing that stood out to me this morning was people just laugh it off if they've got a problem with their pelvic floor, and just think it's common and I'll just wear a pad and it's fine, and I've had children and I expect it. But yes, it's very common, but no, it's not normal. And please don't just continue to buy loads and loads of pads, because the manufacturers who are making the pads will love you, but your pelvic floor muscles will just keep getting worse. So I think from a women's health physiotherapy point of view, I really need to sing the message out that your pelvic floor muscles are so important and we do need to be more aware of them and giving them a lot more attention. And the reason why is because if you don't know what a prolapse is, I'm just going to show you my little chicken. I got this from Gusset Gripper's lady, Elaine Miller, when I went to watch her in Scotland, when she was doing the, what did I do in Edinburgh? Edinburgh Festival, and she gave it to me as a prop. But anyway, a prolapse, if we're just really crude about this, but a prolapse is where your bits hang down or bulge out, and that is prolapse. That classically comes in a lady from their vagina. And there's lots of different types of prolapse. So a prolapse will feel to you like a bulging, a dragging down, a heaviness, and it often feels worse at the end of the day. It normally goes off if you're sat, but if you're standing for long periods of time, it can also feel worse, and sometimes you can get lower back pain from having a prolapse. So there are different types of prolapses, going back to the chicken. If you think of the three passages we've got in our pelvis, so we've got our bladder, we've got the uterus, the vagina in the middle, and then we've got the bowel at the back. Then classically what happens as the pelvic floor weakens is that the vaginal walls, either the bowel can collapse through the back and in, or the bladder passage can collapse through the front and in the vagina, and then they can hang down. Or classically the uterus that sits on top of the vagina can also hang down, and that's called uterus prolapse. So sometimes the bladder one can be called a cystocele, but it's now commonly known as an anterior prolapse. The bowel prolapse was termed a rectocele, but is actually now called posterior prolapse, and the uterus is the apical prolapse, when the top of the uterus can sink down into the vagina. And obviously that to you and me feels like something bulky is hanging down, something there that shouldn't be, and quite rightly that needs checking out and you need to be seen for that. So if you've got that or symptoms like that, please don't put up with it. Go and see somebody about it, whether it's your GP, whether you self-refer to a continence clinic, or whether you try and get seen by a women's health physiotherapist for proper pelvic floor assessment and advice. That would definitely be something I would recommend. So in terms of a prolapse, who gets it? Well, it's classically linked to pregnancy and childbirth, but it is also, we see it in ladies who have not had children as well, and the reasons for that can be due to being overweight or doing really heavy lifting where there's lots of pressure down on the pelvic floor for lots of periods of time. So if you're in a job such as looking after people in a nursing home that require a lot of moving and handling, or you work in a day nursery and you do lots of lifting up of babies or small children as part of your role, then your pelvic floor is getting a lot more pressure put through it during the day. So you're also at risk of prolapse if you're not working the pelvic floor muscles to help off, be able to manage that pressure. Other things that also commonly are related to prolapse, so you can either get it when you're pregnant, you can often get it just after you've delivered a baby, or it may catch up with you in the menopause as the estrogen levels and your hormones start to change. So if you've not had a prolapse when you're pregnant or just given birth and you think, yes, I've got away with it, it's as your body gets older and ages and the signs of the menopause, it might catch up with you then. So it is really important that your pelvic floor muscles become part of your day-to-day routine, and they're practiced every day for life, I'm afraid, not just for Christmas. because we can prevent prolapse and we can prevent incontinence just by working our pelvic floor, which is huge when you think about it. Just from working one muscle, we can stop leakages, stop the embarrassment, stop all the things that come with that, and also prevent and reduce the risk of getting a prolapse. So this video is kind of there as a little bit of a message and a sing out to people to say, you know, prevention is better than cure, and pelvic floor exercises take up minutes in your day to do. I think 2 to 3 minutes maximum, and we should be doing them 3 times a day. So the message about the prolapse blog really was just to put it out there, what it is, what it feels like, how we can prevent it. So 1 in 3 ladies who have had 1 or more children are at risk of developing a prolapse. But 1 in 9 of those ladies will go on to have surgery for that prolapse. So we can manage prolapse without the need for surgery. And some ladies do nothing and they live with it because it's not bothersome to them in their day-to-day life. Other ladies take up pelvic floor exercises and do it regularly as their routine, and that helps reduce the symptoms massively, and they live with it and it doesn't affect them in their day-to-day function. Other ladies try something called a pessary, which is like a ring, which you get inserted up into the vagina, and it kind of pushes the walls back up where they should be and keeps everything lifted. But it's a bit of a trial and error with that in terms of measurements and size, and sometimes you have to try a few before you find the right one that works for you. So some ladies give up on that before they've found the best fit for them. And then obviously the end alternative is surgery, and it depends on whether you're still sexually active, whether you're still having children, and how severe your prolapse is, because they grade it in stages 1 to 4. Would affect the type of surgery that you have. So a gynecologist would speak to you about that. But obviously I don't expect people to bombard me with messages on my Facebook page or anything, but if you do have any messages and you want to privately message me with any questions, please do, because I can hopefully answer them, and if not, I will point you in the right direction of where you can get help or more information. So I hope this has just sang a little message out about pelvic floor exercises to you, and just remember the chicken. We want to prevent this rather than having to then deal with it when it's arisen. So get squeezing your pelvic floor, and if you're not sure how to, then again, please message me. There's lots of information out there about how you should be doing your pelvic floor exercises correctly, so just make sure that you are working them in the right way. Okay, bye for now.